Campylobacter, one of the most common bacterial causes of foodborne illness. Campylobacter species are gram-negative, curved or spiral-shaped bacteria, often appearing in a distinct or gull wing shape under the microscope. They are microaerophilic, requiring low oxygen levels to grow, and they thrive in the digestive tracts of animals, especially poultry. The most common disease-causing species are Campylobacter jejuni and Campylobacter coli. These bacteria are highly motile, moving in a corkscrew-like motion thanks to their single polar flagellum. Infection typically occurs through contaminated food or water, particularly undercooked poultry, unpasteurized dairy, and cross-contaminated surfaces. Biomedical scientists play a crucial role in identifying Campylobacter and guiding treatment. Morphology and growth. Campylobacter, blood-free agar, also known as CCDA, produces moist, flat, greyish colonies. Scirrhose agar supports Campylobacter growth with antibiotics to inhibit competing bacteria. Blood agar at 42 degrees Celsius under microaerophilic conditions exploits its adaptation to the avian gut. Campylobacter jejuni thrives at this elevated temperature, unlike most enteric pathogens. Further identification involves biochemical tests that help further identify the organism. Oxidase test, positive, distinguishing it from Enterobacteriaceae. Catalase test, positive. Hippurate hydrolysis test, positive for Campylobacter jejuni, negative for Campylobacter coli. Advanced techniques like PCR and MALDI-TOF, MS, provide rapid and precise identification, ensuring rapid turnaround time. Campylobacter clinical presentation includes diarrhea, sometimes bloody fever, nausea, abdominal cramps, and vomiting. While most cases resolve on their own, severe infections, especially in young children, older adults, and immunocompromised individuals, may require antibiotic treatment. Treatment typically includes fluoroquinolones like ciprofloxacin or macrolides like azithromycin. However, antimicrobial resistance, or AMR, is a growing concern, particularly fluoroquinolone resistance, due to overuse in both human medicine and livestock farming. Scientists perform antimicrobial susceptibility testing to ensure the most effective and safest treatment. Misuse of antibiotics or incorrect prescribing fuels antimicrobial resistance, making infections harder to treat. This content is for educational purposes only. Follow for more microbiology lectures and subscribe to Science 4 Fun Academy. Thanks for watching.